Welcome back. This section of the show is called Ask FPA. If you don't get a chance to ask your doctor in the exam room, you can do it here on television. You can send your medical questions to tv@fpalex.com and include your name if you would like us to use it on the air. Tonight's question is, what immunizations are required for schools in Kentucky? Asked by Cindy Thomas of Lexington, Kentucky. And here to help me answer that is my daughter and my partner at Family Practice Associates, Dr. Amanda Foxx. Welcome. So, there are some new changes, new vaccines required this year.
Yeah, so everybody knows kind of the regular vaccines that have been required to go to school, like the pertussis or the whooping cough vaccine and the MMR and the chickenpox vaccine. But now we have two new vaccines that are required. One is the hepatitis A vaccine, which many pediatricians and family doctors were giving anyways, but now it is required to go into daycares and schools. You can give that in your 1-year-old shots even, but you can give it anytime into adulthood. And then we're also now requiring a second meningitis booster at age 16. Everybody had that requirement in 6th grade to get the first booster, but now they do need to get the second one when they're 16 years old.
So why should we be worried about meningitis? What is it and why should we get vaccinated for it?
Meningitis is a bacteria that causes an infection in your spinal cord and in your brain, and it can be deadly. So our vaccine protects us against a couple of different types of those bacteria.
So you talked about the new vaccine. Vaccines are relatively safe. I mean, we've heard a lot about autism, which is not proven to be true, but tell us about the concerns.
Right. So any medication that we put in somebody's body, so a vaccine is like a medication that we put in somebody's body, could have adverse events, and we want to make sure that they're safe, and we want to study them continuously to make sure that they're not causing problems. In the past, there was a study that suggested that vaccines caused autism, and that study was wrong. We have looked at that data. It is not true. Vaccines don't cause autism. They can cause side effects, and we always want to monitor that. But all the vaccines that we recommend are very safe. We wouldn't recommend anything that wasn't safe.
And the side effects are minimal. Tell us what they might be.
So they could have you have body aches, you could run a fever, you could get redness or a rash around where we gave you the shot. And if you have those side effects, you would want to definitely let your doctor know.
But those side effects are minimal compared to what the vaccine can prevent and the diseases that are caused by it.
Absolutely.
Now, we talked about those new vaccines. They don't go into effect this year. They go into July of 2018.
Right. We want you to come in this year and get your vaccines updated just in your regular checkup. But unless you have those vaccines by July 1st of 2018, they won't let you back into school.
All right. Now, tell us just about some basic vaccines that everybody needs to get.
So, for kids, we do a lot of vaccines when they're 2, 4, 6 months old, and those are the whooping cough, another meningitis vaccine, and pneumonia vaccine. And then when you go to 6th grade, you get some shots, and then you need to get a flu shot every year. And then for adults, when you turn 50 or 60, kind of depending on what your primary care doctor recommends, we recommend getting a shingle shot.
Okay. You also mentioned pneumonia for kids, but pneumonia and flu is important for adults also.
Right. So when you turn 65, you should get a pneumonia shot. You actually get 2, one when you're 65 and one when you're 66. If you have another medical problem like diabetes or asthma or lung disease, you need to get that pneumonia shot earlier.
All right, now that's a little bit about vaccines. Everybody needs to do it. So why do we need to come to the doctor? Why does a healthy child need to come to the doctor just anyway?
Right, so it's just good to check their weight and their height to make sure that they're growing. We check them on a curve to make sure that they're getting enough calories in, enough nutrients. We go over some healthy habits. Another important thing after 5 years old is to check a blood pressure of your child. The American Academy of Pediatrics actually just came out with new blood pressure guidelines. So that's part of the checkup, just making sure that we're not having any problems there.
And also it's a good time with obesity being an epidemic, especially in Kentucky, to talk to the child about healthy eating and weight loss.
Right.
All right, that's great information. Thanks for coming in. And now this summary is brought to you by Baptist Health. It's a summary of immunizations on Health Talks.
A vaccine is typically an injection that increases your immune system ability to fight a disease. It makes your immune system remember something, so then if it sees it again, it can fight it. Most of the vaccines that we give are actually dead viruses. They are not going to give you the virus. They are very safe. We have done study after study on thousands of children to adults to be able to have these approved for the FDA. There are lots of different types of vaccines for all different ages, from birth all the way up until age 65. And then kind of periodically recurring things like flu shots. And we want to get them done right when we recommend them because we want to give as much prevention as we can. So having an annual regular checkup is one of the most important things to be able to have your preventative care up to date. And immunizations or vaccines are part of that regular checkup. We want to think about herd immunity even within your house. We don't want things spreading. We think of the flu. We have flu epidemics every winter, and we just don't want things that are more serious that we don't have treatments for that would spread rapidly and cause illness all over the country. You don't want to be a person with a suppressed immune system if we had a measles outbreaks or if we have the whooping cough outbreak, for example. And you also don't want to be patient zero, the person who started it all over the country.